Emily. I'm going to be your nurse today. Can you go ahead and start by verifying your name and date of birth for me? Kim Johnson, 3/27/1995. Okay, awesome. That's what I have on my MAR as well. So the doctor just wanted me to come in and do a catheter insertion on you. This is just so we can make sure and be monitoring your urine output to make sure that everything is balanced and equal as it should be. Is that okay? Yes? Okay, great. So I'm going to go get my supplies and then I'll be back and we'll start the process. So then I would hand hygiene out of the room again, and I would put gloves on. And I'm going to spray down the table. Normally we would have standing wipes, but we're going to use this spray instead. And per the manufacturer's instructions, I'll let it dry for about 2 minutes. And it's already at waist height, so I won't need to move the table at all. Okay, so as that dries, I'm going to get it next to the patient's bed. Janet, I'm going to go ahead and pull the covers down and get you in position here for the insertion. Gonna pull this up. If at any time you feel uncomfortable, just let me know. Also, a pericare needs to be performed before the insertion, and I would either perform that myself or have my aide help me and do that, and that was done about 5 minutes ago, so that's good. I'm gonna go ahead and put my biohazard bag down here. Go ahead and take my gloves off, hand hygiene again. Now we're ready to start the sterile procedure. I have my sterile gloves here because in the kit they are buried, and so I don't want to contaminate, so I'm going to use those. So I'm going to go ahead and open the kit. Wait for me. I'm going to flip it around so no contents falls out. Slide this off, put that in the trash can, and go ahead and open this up, maintaining the sterile 1-inch margins. And as you can see there, the sterile gloves are not on top, so I'm going to go ahead and open these up over here. Cup end facing me. Going to pinch here. Go. Slide this off, hands are above my waist still, then I'm going to go ahead and touch this and have that be a square. Gonna go ahead and take the tray out since this is all a sterile field still. Gonna put these gloves here, and I'm gonna put this drape down, making sure that the shiny side is down. Since the mannequin can't help me move, I may contaminate while laying this down, but for simulation purposes, I'm just going to keep going. So that's done, and my hand did touch the leg there, so that would be contaminated, but like I said, since the mannequin can't move, I'm going to keep going. The second drape, which has the hole in the middle, once again, wrap this around your hand, place on the patient so she's covered. And since this is sterile, I can go ahead and touch all this and make sure that it's in a good position. Okay, there we go. Now I'm going to start by putting this iodine on the cotton balls. Making sure they get completely saturated. Then I'm going to put this lubricating jelly in the well here. There we go. Next I'm going to take this blue bag off of the catheter. Place this in the well and make sure that that lubricating jelly gets all on it, as that will help with insertion. Just gonna leave that there for a second. And then next I'm going to take my sterile water and attach this here until I hear a little pop. Okay, there we go. Next I'm going to use these cotton balls to clean and make sure that it's completely sterile. And at this point I'm going to contaminate my left hand, so I will make sure to not move it the rest of this procedure here. So I'm going to open this up and do one swipe down away from me. Next swipe towards me. And then lastly, I will do one just down the middle here. There we go. Okay, and then I'm going to put this catheter tip in the box here since this is still sterile. I'm going to move this over to my sterile field over here. And then I will insert this in the urethra about 3 to 4 inches, and then if I hit resistance, I will stop. And then once I start seeing urine, I will go about 1 inch more before I inflate the balloon. So about right now I would start seeing urine, so I'm going to go ahead and stop. Then I'm going to take this, use my sterile water to inflate the balloon. Okay, then I'll give this a little tug just to make sure that it's secured, which it is, so it won't be ripped out. And then at this time the sterile procedure is over, so I can go ahead and use my gloves to tear this. Get rid of all of this. And I'm going to leave the catheter up here because I need to secure it still. Take these off. Hand hygiene. And then get regular gloves. And for simulation purposes, I'm going to use tape to secure this to their leg, but in a hospital setting, I would most likely use a stat lock. If this tape will work. Okay, there we go. So I'm gonna get 2 pieces. And then secure it to her leg right about here. Cam, are you doing okay still? Having any discomfort or pain? No? Okay, great. So now that's secured to the leg there. I'll take the bag, making sure there's no kinks, and I'll use this to secure it to the bed, just to make sure that it doesn't move. And then I'll place the bag below the bladder, making sure that it doesn't touch the floor. I'll just secure it on the bed here. Okay, are you still doing okay? Are you in any pain? No? Okay, great. So I'm going to go ahead and just get you back repositioned here. Make sure her collar is in reach. Make sure that she's comfortable. And the doctor will be in shortly.